recall the first time you play pickleball? So the first few times when you play pickleball is a bit awkward. Like you try to feel how is it like to hold the paddle, how much force do I need to use. So this is what we call motor planning. So with repetition, you learn, oh, okay, this is how I use my body. This is how I should move. Then it will become stored in your motor library. So the next time when you do it, you remember how to do it without really thinking about how to do it. This is motor planning.
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
Welcome to Adapting Together, the podcast where we empower, support, and inspire family with neurodivergent individuals. I'm Xin Yi. Together with me, we have Caerlyn and Carmen. We are the co-hosts for today. So today we are diving into a topic that many parents ask about, sensory integration. So if your child avoids noisy places or seems overwhelmed by lights or sound, you are not alone because this could be the signs of sensory processing differences. So to help us understand this topic better, today we have Jacqlynn, a pediatric occupational therapist and the co-founder of the Passion Hub, a neurodiversity affirming therapy and an education center in Malaysia. So with 11 years of experience and a strong foundation in sensory integration, Jacqlynn is passionate about creating a safe, inclusive spaces where children and families can thrive. So without further ado, let's welcome Jacqlynn to the show.
Hi.
Jacqlynn, hi. Thank you
Hello.
so much for joining us today. Let us begin by getting to know you a little. Can you tell us a bit about yourself and also your role as an OT?
Thank you. Thank you so much for having me on this podcast. I'm really excited when I get the invitation. So, I'm a pediatric occupational therapist, but I do support young toddler up to young adults in my current work. So, when we talk about occupational therapists back then, maybe 10 years before, people would think like, oh, do you help people to find a job? But now we get to know, okay, every children with special needs, they need to see an OT. So what does this OT actually means? The occupation actually means, to put it simple, what we do to occupy our 24 hours. That's what occupation means. That is meaningful to us. So whether it's like play, that we go to school to learn, we take care of ourselves, like we take our shower, we go to sleep, or we make friends. So these are all occupation. So we do have a standard definition of what OT is by the World Federation. It is a profession that promotes health and well-being through supporting participation in meaningful occupation that people want to do, need to do, or expected to do. So for our children, their occupation would be like playing, they eat, they sleep, they spend a lot of time at school to learn, they move around, they connect with others. And also my role mainly is to do assessment and also provide intervention, but not only individual, but also some group sessions. And most of the time, I work very closely with my fellow colleagues who are clinical psychologists, speech therapists, they are educators, and also parents. So this is like what my current role is.
Wow, that's a lot. And really appreciate your time and to come and share with us. So I think OT is something that quite a lot of our community parents quite aware, you know. But let's talk a little bit about sensory integration. So maybe you can explain a little bit more and why is it so important, you know, for our children, especially the one on the spectrum.
Yeah. Thank you, Carmen. So we commonly hear about the five senses, right? Yeah, like what we see, what we hear, the smell, taste, and also touch. But we also have three lesser known senses. The first one is proprioception, or to put it simple, is the joint sense. It's the sense that tells us about our body awareness. about our joints and muscles. The receptors are in the joints and muscles. So why is it important for? It's important for us to imitate something. Let's say you see someone dancing Zumba on the TV. Somehow the person don't jump out from the TV and hold your hand and how to move, but we know how to move by just watching, right? Or when we are driving, our eyes is looking at the front, but we know that, oh, my leg is pressing on the petrol or I'm pressing on the brake, and how much force am I using it? So that's the functions of the joint sense or the proprioception. And then we have the vestibular sense. To put it simple, is the gravity sense. It tells us about where is the gravity, and I'm balanced. The receptor is in our inner ear. And it's actually one of the most complex sensory system because it works together with our eyes, it works together with our movements. So it plays quite a vital role in our daily life. Yeah. And the last one is interoception. The intero means the internal awareness of our organs. The receptors are all in our linings, our hearts, our lungs. So it tells us about, whether I'm breathing very fast, and whether am I hungry, am I thirsty, what is my current emotions and my bodily states, or I'm tired already, or I'm feeling very excited. These are all interoception. So you can see like our daily life, we can't run away from all these senses. In fact, every time, including when we are sleeping, we are all processing these senses. So this sensory system help us to feel what is safety, how can I engage with this world, and how can I use my body. So our brain process this all the time within milliseconds to help us decide how to respond, whether I should stay calm, where should I move, or should I adapt our actions. So this is the reason why a lot of parents or therapists will say, oh, we need to work on the sensory integration first because it is a foundation of how we function in our daily life.
Which I totally agree with. Like, you have to start with something, on the very baseline, the sensory integration. Yeah, before we talk about, hey, the kids ready to do some table tasks, or going to school, or holding a pencil, and etc. Maybe you also can share a little bit with us is like any red flags, that we actually can observe in our children that actually related to sensory processing issue.
Okay, so before I go into the red flag, maybe I can explain a bit more about the key components of sensory integration. Then it's easier for us to see, which fall into which category and how do we see it on the child's behavior, right? To put it simple, it's a neurological process where we receive sensory information and organize it, and then we have a response. So this process have three main components. The first one, the main function is to tell us whether we are safe or not. The technical term is modulation. But to put it simple, it tells us how important is this sensory information. How much attention should I pay and how much energy should I give to this sensory input? The main purpose is to help us to understand, this sensory input, is it safe or dangerous? Like let's say we smell something burning. So our modulation function pick up, we need to pay attention. There's something wrong in my kitchen, or is it from the neighbor, right? So this is the modulation part. Or commonly you will hear something like people say, my child is hyper sensitive or hyposensitive or hyper responsive. All of this fall into the modulation component. Okay, so when we talk about this child is hypersensitive or hyper responsive, it means that the sensory input that doesn't usually has a harmful effect, like it doesn't cause harm. Let's say the cloth flecks in our shirt, you feel something rough, right? But you don't feel like, it's something dangerous, it's gonna poke through my skin, right? But somehow it creates a protective response from the people with sensory issues. Yeah. So the rough texture can somehow elicit the protective response. And the protective response that we mentioned here is the flight or fight response. So to them, they actually feel like, this is not safe. This is painful. I need to do something about it. So it's something that they feel really uncomfortable, even though it's not harmful. So this is what we categorize as hyper responsiveness or hypersensitivity. Some therapists like to use the word responsiveness because when we say sensitivity, maybe people will think that, oh, is there something wrong with the skin or something wrong with the organs? Now, it's much more, we talk about what's happening at the brain level. Yeah, not at the skin or the receptor level. Yeah. Or the other end, we talk about hypo-responsiveness or hyposensitivity. This refer to people who needs more intense or more frequency of the sensory input to be aware of it. Yeah. So maybe they may not appear to hear you when you call their name, or don't when they eat their food and then very messy on their face, they don't realize. So this would be some of the sign of the hypo responsiveness to sensory input. Yep. Okay. So that's only the first category. We have two more. Okay. But the motivation is quite commonly known. Okay. The second one would be the discrimination, or sometimes people call perception. It's about understanding the what it is and where is it. So the first category tells us, is it safe or dangerous? The second category, it tells us what is it and where is it? The discrimination. So I heard a loud sound. Okay, it's not dangerous, but I need to know where is it coming from. Oh, it's coming from teacher talking in front. Yeah. And how loud is it? Okay. And what sound is it? Or teachers talking about something important. I need to take note. Compared to the sound that is made next to my table or my friend knocking on the pen. So this is more on the discrimination part. So some kids or some people struggle with discrimination. Usually you'll see them, their parents usually will see them, oh, very clumsy. They have like buttery fingers. They cannot hold things properly, or they looks like they're very disorganized. And then you want them to follow through like a sequence of tasks. Usually it's very hard. You need to break down into small part so that they can follow through. So these are also some of the symptoms or the things that ask us to look into. Oh, is it something to do with sensory or not? Whether the child can discriminate the properties of the sensory input and where is it coming from? And the last one would be more complex. The technical term is praxis, but the basic idea is we do a simple activity. Do you have a pen with you?
Mm-hmm. Yes, now.
Yes, yes. Okay. So we're gonna think about in 1 minute, we're gonna think about how many ways we can use this pen. So I can use this pen to put into my nose and the mouth. I can put it ears. I can twirl it between my fingers. I can tap it, right? Yeah. So how do we find out all this idea to use a pen? It's just from our experience to interact with the world with the senses. Okay? We call ideation. So let's say I give you something that is round. You don't see it, but you have an idea. Oh, round is something may not be stable. It can be rolled. It's not a really good choice to stand on it, right? If I need to stand on something, I wouldn't pick something that is round, right? So this is what we call ideation, which is part of praxis. So a lot of kids, when I talk about this, a lot of teachers or parents can relate a lot. Like, how come they do things until so hard? It's so simple, but they somehow try the very hard way. They struggle so much to do things. But sometimes it has to do with the ideation. It's so hard for them to conceptualize the properties of things and how to use them together. And then the next part of the practice is motor planning. So this is often seen like very awkward movements. Like let's say today you accidentally drop your car key into the drain. And never in your life climbed under a drain before. But somehow we know, okay, I need to judge how deep is the drain and is my leg long enough to reach it. So all this we need an understanding of how big is my body, how far can I reach, the understanding of the depth, and then how should I move my body so I can go down to the drain and come back out again without feeling trapped. So these are called motor planning. So I need to plan my body to move in an unfamiliar way. Another examples to make it easier for you to relate is maybe you can recall the first time you played pickleball. it's a it's a new sports, right? It looks
Yeah.
like badminton, it looks like tennis, but it's somewhere in between. So the first few time when you play pickleball is a bit awkward. Like you try to feel how is it like to hold the paddle, how much force that I need to use. So this is what we call motor planning. So with repetition, you learn, oh, okay, this is how I use my body. This is how I should move. Then it will become stored in your motor library. So the next time when you do it, you remember how to do it without really thinking about how to do it. This is motor planning. And the last part of practice we call feedback. Okay. So feedback is like, let's say we play the pickleball and then we realize, oh, the ball didn't hit the court where I want it to be. But I remember how much force am I using it and what position I was standing. I need to adjust so that I can reach the goal. So some kids who have difficulties in this area, the parents or teacher will feel very frustrated. Why they keep repeat the same mistake again and again and again and again and don't seem like they need to learn from it. So this is the type that they have praxis issues, or we call the dyspraxia, and particularly towards the feedback. So kids with feedback issues, they don't necessarily benefit from repetition. They need more like coaching. Like, oh, this time you throw, I can see that you use this distance. This is so far from here and it reach here. They need more coaching type to help them to relate the action and the effect. And then they can make the link. But some don't have feedback issues. They can pick up things very fast. Then repetition would be a good choice for them to pick up a skill. So from understanding about safety, is it dangerous? What is it? Where is it? How I use my body and things around me. The whole things are the component of sensory integration and processing. So it can happen as a mix and match. So some kids they have profile like they have certain modulation issue with praxis issue or discrimination issues and praxis issue. So it can be any of them. And this is very high percentage from research, like up to 95% of autistic individuals have sensory processing and integration differences. And also ADHD, it actually quite makes sense because how they are wired are very different from us. So eventually how they perceive, how they sense and organize this sensory input may be different from us. So this is important. We need to move away from the medical model or the deficit lens. We used to think that, oh, if there's a problem, we need to fix it. But now we understand, oh, it's not actually a problem, but it's more of like a different way that can perceive or sense the world and how we can make this world a better place for them and everyone. Yeah. Okay.
Mm. Thank you, Jacqueline, for the detailed explanation. I mean, it really opens up my mind a lot. It's also a lot of overloading of information for me, but I can relate to this because as you were explaining, I was just thinking about my son, and it all it just makes sense that, okay, this is why he does that, and this is why when sometimes we call his name or when something about to hit him, shout at him, also he may not have responded. So maybe that's because of the hypomodulation issue that he might be facing. But then again, when it comes to this, right, we are not taught about all these and we are just normal people. We more laymen, right?
Hmm.
Then we cannot spot the issue that we are not aware that this is some issue to begin with. But seeing how important all this is, right? So we were just thinking, are there any signs or red flags that we can actually see and we can, oh, this is maybe sensory integration issue, and this is where I may want to take my children to see an occupational therapy.
Yeah. Okay. That's actually very, very valid question. So the baseline is we look at whether the child occupation is affected. Yeah, let's say the child cry a lot and struggle a lot with hair cutting. The hair cutting is a very important part of a child occupation, right? So definitely it's affected. So the next question we ask ourselves is there any possibility that sensory is a factor? So now that you learn there are 8 senses and there are different parts of the sensory system, then we have maybe there are some clues. Oh yeah, hair cutting, there are some sound, there's some textures that's involved in this activity. Then it invites us to be curious whether, oh, I need to bring my child to see an occupational therapist. So the baseline is whether it affects the daily living participation and whether the activity itself has a sensory components to it. If you want to really say like a red flag, then I'll look at whether the child is usually distressed by sensory input. So that will give us some clue to the modulation, the hyper responsiveness. Like, oh, they are distressed by certain texture, they don't like certain food, they don't like certain sound, or they to a point that it affects their sleep, they get very restless going to certain spaces. Then these are the common things that we need to be curious. The hypo type is the one that you look like they don't really participate. You need to really bring the child's energy out, engage with them so much every time. It looks like they're always draping over the furniture. They're very hard to get them activated. Then, also another possible sign, the discrimination part usually it's easy to spot in terms of skill. Like very hard to hold a pencil. They can't do skipping rope compared to their peers. So these are the signs that, oh, I need to really consider the sensory part for the discrimination. The praxis part is a bit tricky to look at, especially for young children, but we usually look at how they play. So do they have a lot of ideas to play or not? Or they always use one toy for one things? Then also we need to be curious about the sensory part. So I hope this gives you an overview about what we need to look out for and then when we need to bring for the assessment or consultation.
Again, a lot of example you mentioned is very relatable, as though you know my son from before today, although I first time speak to you. uh, but can I check with you, right?
Hmm.
Is it common that, like for example, cutting hair before this is okay, but suddenly after a while, from that time onward, forever not okay with the shaver? But does this
Hmm.
consider like a sign that we have to pay attention to sensory issue?
Yes, yes. Um, yes, there are a lot of cases that come to me that, oh, last time the child is okay with toys with sound or haircut, then suddenly they're not okay, they reject going, or they stop playing, or they have certain distress. Especially if there are different diagnoses, like oh they are autistic and they have sensory issues. So to make it clear that sensory issues is not only for autistic. Yeah, we have people who don't have any other diagnosis but with sensory differences, but to a point that they affect their daily life. So they are also fall into the sensory integration dysfunction, or do we call it differences nowadays? But if there are different diagnoses or co-occurring condition like autism or ADHD, then it's much more complex. Yeah, it also we need help from the teachers and parents or the behavioral therapists to actually look into what actually happened in that incident. What was the a possible antecedent or any factors that make the child learn that okay, this experience is dangerous, is not safe, and I'm not going to try that again without any other support. Yeah. And some signs are more prominent as the child grows up. So some are as prominent as they are baby. They are not okay with diaper changing. They have difficulty with feeding with bottles. And most of them, they realize during preschool when they start to go to kindergarten, then they realize, oh, why the child is not okay with other child crying. Yeah. And some, especially those with praxis problem, they are all mostly identified during primary school where they are more expected to do more independent and more lengthy tasks. Then they'll say, oh, this child doesn't seem like they can focus or carry out the task just like any other peers. Mm.
I can see that it's not very difficult to spot these signal or feedback that invite
Mm.
our concerns. But I think culturally we also have a perception that sometimes people will tell the concerned parents, "Aya, it's okay one maybe my who also 5 years old only learn this, so it's a bit slow, it's fine." So I think these are the common perception that might actually prevent or delay some concerned parents from seeking help from people like you.
Yes, yes. I think at the end of the day, we need to come back to ourselves as a family and to decide what is important for your family right now. So we have so many skills to learn, but it actually come back to the family, like, oh, having a peaceful mealtime is so important for my family at this point. So I want to work on that. And the rest, like the tiptoeing, walking around the class, not as important as the mealtime at this moment. And that's okay. Yeah. So it's very important you can have like a conversation and discussion with your therapist to tell them what is your priority, and then they can share their perspective and work on a common goal along the way. Yeah.
I see. That's very good advice.
Yeah, I really like that idea of like, because when Jacqueline shared about the whole sensory integration, there's so many things, and also it's kind of like a lifelong learning thing, right? And until to even say you want to hold a friendship, that also another different set of skill that they need to learn and continue to grow. So I would say that it's so important that to set the priority, like just now what Jacqueline said, as a family or as a team together with the multidisciplinary team, right, to decide what is actually the main target that we can actually set for them. That's very, very important. So I would like to also check maybe how is it the sensory integration assessed in the whole OT setting, because we talk a lot about, I just want to know, how as as a OT, how this thing you will be assessed as a first or initial appointment. Yeah.
As much as we are really focused on the sensory, I need to jump out as an OT first. So usually kids are brought to OT. The referral from OT is because they have some issue with their daily participation of activities, right? Their school, it can be a therapy environment, it can be a home environment. So when we pick up signs during parent interview about, oh, there's possibility of some sensory things that I want to investigate further. So we will do a sensory integration assessment. So the assessment actually have three types, and then you need to have at least two types to make a more constructive conclusion. Yeah. So the first type is, of course, the parents and caregiver interview. So your OT will ask you, oh, how is your child like when they're mealtime? And is there picky eater? Or sometimes they have like standardized questionnaires, like the sensory profile or sensory processing measure. There are some set of questionnaire for you to tick what are the behavior that you observe in your home environment. They even have school forms. So there are forms that they will send to your child's teacher to rate, so that we can know that what are the behaviors like in the home and the school setting. So in some assessment, they even have the school bus or a certain specific settings questionnaires. Yeah. And then we will have two other type is the clinical observation. Means the OT need to really interact with your child or see the video of the child or really interact with the child. So play with the child, they will do some activity with the child or ask your child to do something. And then they will observe the quality of the movements or how the child respond, like the test about the pen. So we have things like that. Oh, can you show me how you use this chair in a different ways? So then these are the example of the clinical observations. Yeah. And then the last part would be the standardized tools. So to date, there are a few questionnaires that are standardized, means there are scores that are compared to a big group of children to tell you or whether this presentation is it within the norm expectation or away from the norm. And there are two tools. One is the SIPT, Sensory Integration and Praxis Test. It's a huge kit. There are a lot of tests inside, and then you need to have certification to do it, which the whole world is slowly fading off because of the cost effectiveness, and also it's really tedious for the child. You need about actually 2 days to finish it. And then there's a new one called EASI, so Evaluation of Area Sensory Integration. It's much more cost friendly, and then it has a wide range of norm. They actually collect data for even Asian countries. So this is the current assessment tool that is standardized for sensory integration. So for us to make a conclusion about, oh, the child is hyper responsive to certain things, they have this specific discrimination problem, we need to collect data from at least two sources. We need to have the parent and caregiver school interview, at least with a clinical observation if the clinic don't have access to the standardized tool, or they have the standardized tool with the parent caregiver interview. We can't decide that, oh, by watching the child doing this, or they has this problem. So it actually involves much more of the clinical reasoning and observation and interpretation to do the assessment. And usually it takes about at least 1.5 hours of interacting with the child, consultation with the parents to make that kind of analysis.
I think I can see some similarities also as a behavior analyst when we do assessment. It is also I see how OT and also that behavior analyst perspective. We also do have like a direct, meaning a direct observation. We see right away how the kid perform in a natural environment. And then we have indirect, like what Jacqlynn said about interviews from parents, and also doing some experiment where we call it like a functional analysis. It's somehow similar, like how we want to take data and then we want to experiment how the kid behave in when we manage the environment differently. But I guess the things that we look into are different, but the assessment looks, yeah, okay. Right. Thanks for sharing that part. Then when I think we talked also a lot about that, how OT, different learning about different sensory profiles and integration. What do sensory integration intervention will look like in a session? Once we have find out, yeah, we have more information already.
Yes. This is also another, it's a big part. Actually, this is the reason why I went for the certification program, because there's so many things that's happening around, the internet, the people telling things. Then even me myself as a fresh grad therapist that time, I was so clueless. Yeah. Yeah. So the intervention itself, there are two different types. The first type is the one that the therapists need to go for certification to do it. They call the AIR sensory integration. They have like a list of criteria you need to fulfill in order to claim that you do this intervention or therapy. Yeah. So there are some of the criteria, like you need to be play-based, you need to be child-led. There are certain criteria you need to fulfill in the sensory integration gene, like the safety features of it, what are the equipments you must have, and then there are things that are called just right challenge, like some of the concept that you need to adhere to in order to claim that you do the ASI intervention. But how it looks like for parents' perspective is, oh, my child go to this fun playground looking place, and then has a lot of fun with the therapist. They use different equipment. Yes, it looks like that. But in that process, first we establish safety and trust with the child. And then because it's child led, so we actually follow the child interests, or we use their interests as a medium to introduce challenges for them. So in that process, they learn more control and autonomy so that they feel safe to interact a little bit more with the texture that are not comfortable for them in a safe way. And they have much control that they can say no at any time. Yeah. Or in that process, they learn more how to use their body more accurately. Oh, I need to twist my body this way. This is how I should engage my core muscle. So in that play itself, we actually put in the challenges so that we can achieve certain goals that is related to sensory integration. So that said, you need a qualified therapist and a specialized clinic is not so accessible, right? It's not very practical to bring my kid, 3 times a week or 2 times a week. We have a different type of intervention we call the responsive sensory integration techniques, where we do as a parents or as teachers or anyone in public. Okay, so when I see my child is showing distress, what I can do is I offer the calming activities, or before activity is distressing, like let's say before I bring my son for haircut, I can have some activities that help them to feel better and more organized before I go for the activity. Of course, you can pair with other strategies like cognitive strategies, like you have social stories, you like help them see videos of the hair cutting procedure, you have whole role play about hair cutting. And then before we go hair cutting, maybe we go on the trampoline, or we use the activities to help them to calm and ground their body before we go for the haircut activity, the event, right? So this is what we call the responsive type. Or there are certain protocols, like maybe you heard about the brushing, the therapist will do the specific brushing. But actually the protocol, when there's a word about protocol, you need to go through proper training because there are set rules of how to do it, what to observe and what not to do. Yeah. Or some listening program. Maybe you come across some pictures, or you come across some therapists will make your child listen to a specific album or the program. So these are all the little strategies that is based from the understanding of sensory integration, but we can use it outside of a typical clinic setting. Yeah. So there are two different intervention types, and both actually complement each other. Yeah. Mm.
Okay, so meaning that it's actually because a lot of parents also ask like, can we have more session of OT? But in Malaysian practice, it's actually most of the time is once a week, right? And then a lot of times, OT also set some activities that they can generalize it or do it or in a more natural setting or in a home setting or at a nearby playground and things like that. Yeah. What are some simple sensory friendly strategies, or tools that you think parents can actually use it at home or also in the classroom? Yeah.
Okay. They are not specific to a person, just a general
Yeah, correct.
example, because I need to know the person or the family. So when we
Mm,
do like suggestions or recommendation,
mm,
we need to look at the parents' capacity, right? We
mm,
cannot, it's very hard that for a parent to come back with a whole list of things to do, but they feel like, oh, I don't have that resources, or I don't have that capacity to do. So the first thing we need to check as a therapist is what is the capacity of the parents and whether it's practical or not. So it can be as simple as, oh, I can prepare a kit in the car, and then in that kit there are some fidget tool, or there are some things that my child can eat or chew as a snack. That itself is a sensory activities already. Or if I have the luxury of bringing my kids to go to a swimming pool, and swimming actually is one of a very good exercise because you are covered in water. There's a lot of tactile perception in your body, and then it's a very rhythmic movement. So we are very sensitive to rhythm as human, as since we are born, right? So when we are a baby in mother's womb, we are used to the rhythm in my mom's heartbeat, my mom's movement. And rhythm itself is actually quite regulating. So that's why our kids sometimes they sing, they chant, they like certain sequence because it's actually very calming for them. So anything to do with rhythm is actually quite a good tool to use. Okay. Another one is more of when you have doubt, usually we use deep pressure. So deep pressure means you squeeze, like the deep massage, right? This is more like the passive. You give it to the child. Or something the child can do. They can do push up, they can jump, they can do animal walk. So all these activities are actually we call heavy work activity. It stimulates a lot of the proprioception, the joint sense. And the joint sense have a natural calming effect. It has a calming effect on any other senses. So it's our go-to. Or sometimes you'll see the child likes confined space. They starve with a lot of things and then they hide inside. Or they love the ball pool. So it actually it takes a collaboration with the therapist to have the understanding of the child's sensory profile, and also what is the family routine like. And then we try to insert along the routine. So the basic guideline is what makes my child excited. Then we call the alerting activity. What helps my child to calm down? We call the calming activities. And what are the things that help them organized? So we call the organizing activities. So sometimes you Google it, you can find sensory diets. So that's what they mean. So they actually look into a routine, and then in your routine, what can I put inside to help my child to be more successful at the things that they are going to do in their daily life? Yeah.
Yes, it sounds very possible to include, into our daily life if we start with small target, right? Because sometimes when we have too many ideas, too many problems that we want to settle at one go, I think that overwhelm parents and the family. Yeah, if we can start with small little targets at one time and periodically, every week when you see your OT, then you can add in, hey, what is the next new thing if you see a improvement and achievement from there. Yeah, thanks a lot, Jacqueline, for sharing that part. And definitely we would like to also know, there's so many OT out there now, and would like to know about in terms of certification, how are the therapists actually trained in sensory integration, and what the certification they involve in this training process.
Yeah. Thank you, Carmen. That's an important question. Yeah. To put it simple, every allied health professionals, especially the OT, sometimes the speech therapists, physio, maybe a clinical psychologist, we are all being trained or being lectured about sensory integration in our undergraduate studies, or at least during our internship, we are exposed to basic understanding. So once the person is graduate from a accredited university, you have basic understanding. Because as a allied health professionals, you somehow need to do your specialization as you progress. So like OT is not only for children, but also for elderly people, for sports rehab, for injury, for neuro cases like stroke. Yeah. And then as we practice, we maybe will specialize, oh, I like to do pediatric, let's say. And then to do that specialization, sometimes you need to add on certain approaches that is suitable for that setting. So maybe you heard about floor time or social thinking. So these are some of the approaches that we commonly see, and sensory integration is one of it. Yeah. So the last time we don't have much choices. There's only very limited places that we can do our accreditation or certification. Is the University of Southern California in collaboration with Western Psychological Services. There's only one organization that do that until 2016. And then after that, this pathway is somehow not continued. And then there are new organizations that can do it. So I'm going to share one of it that is more commonly accessible. It's called CLASSI, Collaborative for Leadership in Area Sensory Integration. You can find it online, and then there are much more details about the certification and all. Why I want to bring it out is that there are 6 modules. So no matter what pathway you go, there are 6 modules or sometimes lesser modules, but the amount of contact hours and the topics to cover are generally the same. There are, I think, about 4 to 5 organizations that are accredited. You can search it online as well on the International Council for Education in Area Sensory Integration. Then you can see, oh, which organization are accredited. Okay, so for Class C, there are 6 modules. The first module, the Introduction to Theory of Sensory Integration, is actually open to all. So parents, doctors, teachers, anyone who are interested to know about sensory integration, you can actually take it. And it's mostly online. Yeah, and you have 1 year access to it. So the second module to module 4 is about assessment. Then the assessment part, clinical reasoning part, is only open for qualified health professionals like OT, speech therapists, medical doctors. And then module 5 is about intervention, how we do therapy, and also open to all. Yeah, so if you want to know about sensor integration, you can take module 1 and module 5. Yeah, only the module 6, the hands-on practical, then it's only open for occupational therapists, speech therapists, and physiotherapists. So they are much more accessible nowadays, and certainly there are different organizations that don't do certification, but they do provide like decent workshop that give you enough information without overloading you to know about sensory integration. So basically, if you are a therapist and you want to be certified in area sensory integration specifically, then you have to go through this certification process, and usually it take about 1 year to complete that.
Thank you, Jacqueline. The program certification that you mentioned, the module 1, module 5 that are open to all. Maybe
Hmm.
after this, we will get the link from you and we will put it into show note. Because I think maybe there are a lot of parents, they might be interested to explore that. myself, once you said that it's open for parents, my eye also bigger already. It's like, oh, I can try and check out. When you were explaining, I was having this idea that, well, it takes a lot of hours and training and studying and a lot of input to get certified and to do what you are doing. Is this the possible reason that we don't have many like occupational therapy in the country? Is it because of the long commitments required?
For a start, it's already very a few of us to start. There's only like less than 5 universities that provide degree in occupational therapy in Malaysia. So there's already very limited of us to start. Because it's a relatively new profession, so they are still looking for more lecturers, more clinical instructors, and then after we graduate, not everyone go into pediatric. So some specialize in other things. So that's even less of us. And even in pediatric, they have different therapists who prefer different approach. So that's why there's very little of us. Of course, surprisingly, it's happening around the world. Yeah, every country they're looking for more OT. It's a worldwide thing. Yeah.
I see, especially now, given the last few years, the diagnosis of autism has increased a lot. If the profession that support this does not increase accordingly, then we will always have the demand outpace the supply issue. And that's
Yeah.
challenging. So if let's say there's a parents who are concerned and they want to do a assessment by OT, is there any public directory or resources that they can find, like if I'm in at this state, w- where we can find an OT or whatnot from the different geographical region they are in?
Yeah. Um, the website that I'm going to share, there's a directory to look for qualified or certified SI practitioner in Malaysia. So you can look up for that, or you can just ask any centers that you send your child with, like, oh, I want to look for OT. Do you know whether the OT is certified in sensory integration? Usually they have a cert to show you. Or another way actually is a good news that actually our 3PK centers, the government part, when they do the screening for our students in the government mainstream setting, they do have OT who are certified in SI. So they actually do that in the government part, just that the wait list is very long and then they are having more. And we actually have a OT who is in Ministry of Education doing a lot of work to trying to push every school to have one OT in the school so that we can support our children in the school setting. So this is also something promising, but definitely a lot of manpower need to do that. And but at least the government is recognizing that, oh, the kids need support at school and there's some things that we need to do, and there are more accessible pathway in the government setting. Yeah.
I think that is really a good news, like to also helping not just children with neurodivergent needs, but also some other typical children who also have sensory concerns, right?
Yeah.
Yeah. Okay. Before we wrap up, are there any common misconceptions about sensory processing that you have often come across?
Yeah. There are a few. Maybe I take some time to talk about something a bit more common. So we often come across the term sensory seeking or sensory avoiding. But to put it in a clinical practice, sensory seeking or sensory avoiding is not exactly the clinical problem. What the therapist is interested is what makes the child seek for that sensory input. For example, the child may look like seeking for movement. They run around, they jump, they stomp their feet. So we'll think that, oh, the child is seeking for vestibular input. But actually, it may not be the case. It may be the child is actually having more sensitivity on the sound, and then they try to do something to calm themselves. And they happen to use movement. So it's very important to look at, yes, the child is seeking for something, and why is it? Yeah, and also the avoiding part. Why is child avoiding? So the sensory seeking and sensory avoiding is not exactly a clinical term that we see, but we need to understand the why underneath it. Then the second misconception is about brushing and wrapping. So somehow it become a very common practice in OT. I'm not sure why. Maybe you come across, the therapist use a heavy blanket or a mat to wrap the child. Well, yes, some child find comfort in that kind of input, but the baseline is the child need to feel safe enough to do it. So if you notice that your child is already crying and struggling and the therapist try to wrap, it's not exactly the recommended way. It's not intended to be like that. We do have a lot of education we need to go on within our profession, but as a parent or a public, when we know that, oh, anything to do with sensory, we need to honor the person with autonomy. The person need to have the right to say no, or this is not comfortable, or maybe this is not the way that I feel comfortable. I need to find other ways that help me regulate it, which is fine. And the brushing itself, they have specific protocol to do it. So we need to have someone who is really trained in it. I myself is not trained in it in brushing, but there are a lot more activities that can achieve the same effect as brushing. So discuss with your therapist for more details or more alternative. And the last one is about exposure to fixed sensitivities. So we used to think that, oh, if my child is scared of loud noise, so I bring my child to all the concerts so that hopefully one day he's going to be okay with it. But however, that's not the case. So even though they may look like they are okay with it, but the internal sensory system is still firing. Just that they learn to shut down or they learn to ignore their sensory needs, which is actually not helpful for their mental health. We learned that hypersensitivity or hyper-responsivity to sensory input is a lifelong condition. Even with therapy, you cannot 100% cure for it because it's very wired, hardly, and it has a lot to do with our survival response. So with therapy and support, you can reduce the impact of the sensitivity to a certain level that don't impact your daily living so much, but the sensitivity will be there. So for the sensory issue, we need to learn that we send our child or when we give therapy for a child, it's not to fix them, but actually to find a way to help them to understand how their body work and how we can find ways to advocate for my needs, to find accommodation, to have a lifestyle that is sustainable. Let's say the child is really have a lot of needs for movements. Eventually we find ways into, oh, maybe a gymnastic would be a good way the child can develop an interest where they can get their needs fulfilled and also they feel good about themselves, like, oh, this is what I do love to do and what I'm good at to do, right? So it's very important to highlight that the concept about fixing and also the way that we support children with sensory differences. Yeah,
Mm. Thank you, Jacqueline. Just now I was thinking about something, but suddenly I lost my train of thought.
that's okay.
I was just okay. Maybe I can go ahead and ask you this, right? Is there like a minimum age that a parents can start to bring the child to see an OT? Is there age like it's too young to do so, or you need to pass certain age band?
Oh, no, no. Yeah. We do see client as young as newborn. Yeah. And toddler and baby below 1 year old. Some trained therapists can detect sensory issues as young as baby. Yeah. Like I mentioned, they have difficulty latching or find very because of the sensitivity of the texture around the mouth, or they are very scared of diaper changing or showering because they don't like being held laying back on the tub where usually we bathe the baby. Yeah, so these are the things that we can pick up, and there are things that we can do as young as a baby or newborn or toddler. Yeah. Hmm.
Now I just hope that I learned all these few years earlier, because from the time he was born until even last year or recently early this year, almost every night my son will wake up crying. So I think that's a sign that he needs to get access. But we didn't know that. We just thought why he always like have nightmare and he woke up consistently one, and his cry is very loud, very sharp. Yeah. So I mean these are the things that only we wish we know earlier. So we only wish that people know more about what people like you can help and support with. So if there's one thing you hope people know about OT or your occupation, what would that be?
Wow. First of
And
all, I actually um it's a lifelong learning. Actually, what we learn now, like in 2025, may not be relevant in 10 years later. So it's important to keep that open mindset, to actually be curious and learn about the other person, what is really meaningful to them. Actually, that's the core value of an OT, because we want them to feel that they can do something that they want to do in their daily living and is meaningful to them. So that's about OT. And then, but there's a message that I want to share, actually, for teachers as well. We are so used to, the very traditional teaching setting. The child had to sit all day long, but humans are not designed to sit all day long. Yeah. Just I was like, oh, okay. If the teacher can, we can work together to somehow bring some flexibility into teaching, it will make the whole world much better place for the teacher and the kids. Yeah, but there's a lot of research already coming out that when we move, we learn better. So it may not be, having a chaos in the classroom. Oh, how am I going to make my child jump with 20 kids? It may as simple as, sticking mahjong paper on the wall and then ask your student to write their points on the wall. It already can help to boost much more of a concentration and interaction within the class and the engagement. There's a lot of interesting research to do with the inclusive classroom. Yeah, so that's something I want to advocate for our kids and our young adults. We are not designed to sit whole day. Like, even we are sitting on a very comfortable office chair, we still move around and we still fidget. So if we don't expect that in the adults, why we expect it in our children, right? Yeah.
Thank you for the powerful reminder and message. I think it's important to have a good learning experience. Then only they will really have the attention required for them to absorb everything they need to absorb, right? So, before we wrap up the episode, do you still have any last message for parents and caregiver? I mean, you just deliver one for teachers. Do you have any message you want to deliver for parents and caregiver?
Yes. About self-compassion, right? Um, as I progress in my journey as a therapist, we learn about things that is no longer useful, right? So then we're like, oh, I should have done that. I shouldn't do that. But we need to have that self-compassion that we are doing the best we can with the capacity we have at that time for the person that we care for. And we are doing that now for the person that we care for right now. So it's important to hold that in our heart also, that yes, there are new information coming in, but also to recognize that, oh, this is my path, my learning journey as well. So, and you are not alone in this. So there are much more initiatives that coming out in Malaysia and even globally to support parents, caregivers, to find ways that we can, best support our children in our household and our little family. Yeah.
Thank you, Jacqueline. That's beautifully summarized. We don't know what we don't know.
Yeah.
So, being hard on ourselves is focused on the past, but our child require and need us to look at the future. So we can only focus on what we can do next. And you summarize it very beautifully by saying that you are not alone, and that's why we have podcasts like this to support one another, empower parents and caregiver to adapt to this new norm, new world, new kind of family way of living together. And with the help of occupational therapists, I'm sure listener can now see how OT and sensory integration plays a very meaningful and crucial role in supporting our children to learn better and also to improve the quality of life, not just for the child, but for the family as well. So thank you very much for listening. And because we don't want to be alone, we want to grow and empower one another. Do share this episode and the whole podcast with anyone you feels like, may benefit from it, or their children, you feel that their children maybe have some sensory processing issue, but you don't know how to start the conversation with the parents, share this episode with them, let them take the time to go through it themselves, and maybe they will have the realization themselves. I'm sure it'd be more powerful than we try to tell them, right? So with that, thank you again, Jacqlynn, and you are listening to Adapting Together.